Welcome to the Care & Co podcast. This is our first edition. My name's King Lawal and I'm the Director of Mega Resources, a domiciliary care provider, a private care provider, and I'm also the Care & Co podcast host. With me today is Chris Stelling. To introduce him, he's the Chief Executive Officer at Carers in Bedfordshire. He's been leading the organisation for about 5 years. Chris has an extensive experience in the third sector, working previously as CEO at Autism Bedfordshire, before joining Carers in Bedfordshire. So Chris is a pioneering force for unpaid carers, and he joins us today at Care & Co to discuss his journey up until this point, his role as CEO in Carers in Bedfordshire, key issues, challenges, and all the successes in the world of carers, future plans, technology shifts, and anything else which may be a game changer in this vital sector. So Chris, hi.
Hi, King. Thanks.
How was your journey in today? Was you affected by the major incidents, the floods?
Yeah, there were a few floods, a few diversions, but got here on time.
Wonderful. And just to start off this discussion, I'd want to know, and I'm sure our audience will want to know from yourself, Chris, why the third sector? Why charities and not-for-profit?
I think for us, and when I speak to other people in our sector, the sector almost kind of chooses you, really. I mean, my career, I started off working for the civil service and quickly kind of got disillusioned with that and the bureaucracy involved and how slow it was to get things done. So then I went to work actually for a private provider as a support worker, working with adults with autism and learning disabilities. So working in a residential home, because that's where I felt I could make more of a difference. And it just so happened then I managed to get a role in a charity that you just alluded to, Autism Bedfordshire, supporting autistic people, children and adults. And ever since then, I've never looked back, really. There's not many sectors like ours where you kind of get to make that difference right on the front line, and you're adaptable enough to kind of change with the needs that you're seeing. You get to hear what people's issues are and then try and help them as best you can. And I've never even considered the private sector to do that, but I'm sure you'll tell me that could be equally done in that sector as well.
Yes, I mean, you worked as a support worker for Autism, first of all, and then you became, was it CEO of Autism?
Well, okay, I sort of did a few different roles in Autism Bedfordshire. So it was working in the children's side, so running summer schemes and play groups and that sort of thing, and then moved into supporting adults, and that's where we started to provide, social groups, employment support, a whole range of things. The barriers for autistic adults to kind of live a meaningful life that's fulfilling to them are an immense amount, both just for them personally, but also kind of more systematic or society-wide. And so, was there as Director of Adult Services before I left for Carers in Bedfordshire, and we were just then about to start up a supported living home in that charity. So, You mentioned that's a fantastic experience and journey thus far. You mentioned about children's services working within that, right? You did a degree at De Montfort University. Strangely enough, I went to De Montfort University as well for my MBA. Oh, okay.
Is that why you decided to go to children's services? Is that sort of linked with your
choice? You've done your research. I always did. So originally, I wanted to be a teacher. That was the original plan, and I could do this degree and then do what's called a PGCE, so it's like a 1-year conversion course. And then as I was doing my work experience in some of the schools, I just thought, this isn't for me. And interestingly, at that time, I was doing a lot of volunteering work, and I was volunteering with young carers at the very same charity I am now. So I've kind of come full circle and realised that education, working in that sector wasn't for me, but absolutely working with young people who were having barriers to whatever they were trying to achieve was what I wanted to do. And then off I went.
Yeah, wonderful. You're now CEO at Carers in Bedfordshire. What's the overarching purpose? What's the purpose of Carers in Bedfordshire?
Sure. Well, we're an organisation that's just celebrated our 20th birthday, and we were started by a wonderful lady called Yvonne Clark, who her son had a motorcycle accident and had a head injury, which dramatically changed his ability to lead his life. And as she'd been thrust into this world of being a carer, she realised there wasn't any support around for her. So she started to do that herself with a couple of volunteers and started phoning people she knew were carers, just checking in and seeing how they're doing. And then it grew and grew into the organisation it is today. And, that the purpose is really to support unpaid carers to live in a caring role for as long as they choose and as best as they can, so that they have the information, resources, understand how the system works, and that emotional support as well, because it's a tiring role. And so that's kind of our mission, and we support people from as young as 4 years of age who are like young carers, so in a caring role that young, if you can believe that, all the way up from there.
Well, that young as 4.
Yes.
I guess, and we can get to that later in terms of young carers, but that is very, very young. No, fantastic. So we're going to just get on some of the key issues facing carers. I read your article on the Carers Trust, and it was a wonderful piece where you examined the current state of unpaid carers support. You've mentioned there's a decline in respite access. So what did you mean by that? Because you mentioned about it being a decline in comparison to a decade ago, right? There was more access then. What's the reason for this decline? Is it funding, lack of provision, information?
Yeah, that's a complex answer, really, and depends who you ask, and that answer will differ. So that's based on statistics in terms of how many people are getting access to respite through the local authority. And that number has declined over that time, despite population rises. So really that decline is even steeper than it appears just in the numbers. Now, if I speak to local authority colleagues, they will tell us it's about funding and funding not being available from central government and efficiencies, austerity, go all the way back to the financial crisis and then ... up to where we are now, still living with those repercussions. If you speak to central government, they'll tell you, well, we've put in the Care Act. Care Act 2014 came into place, and that's a brilliant piece of legislation. And they'll say, well, it's on local authorities to do that job. But they'll say there's not the funding. And when you speak to carers, they will say they don't meet the thresholds to access that support often. And so it's a bit of a complex scenario, really, but access to respite is the biggest barrier to an unpaid carer kind of succeeding in their role or living well in their role. They tell us that time and time again. We do what we call a carers survey. So every 2 years we kind of survey our carers that are registered with us, which is about 13,000 now that are registered for support with us. And over that period of the last 10 years, you can just see that well-being was generally okay. Then COVID came in. It's just been a steep decline ever since.
Yeah, because it's past just it's a strain. It's an it becomes an overburden. Them caring for their loved one if they don't have sufficient respite to be able to take a break and come back, and that seems to be quite a big issue, as you say. What does local authority need to do to try and to enable that to be something of a provision for carers?
Again, if I was a local authority, they would say they need more funding. I mean, I would say that there's lots of ways you can improve and streamline that process so carers can get access to respite quickly and rapidly when they need it. A caring role can change, like that, really. You might be fine one day and then a behaviour change, or suddenly you've got a health appointment yourself you need to go to, and suddenly you need respite. And if you're not financially able to pay for that yourself, the steps you've got to go through to get respite takes a long time. And so that carer then obviously has to sacrifice their own health and well-being because they'll miss that appointment, or they won't go to do this thing, and their social networks decline and everything around it, because there just isn't that rapid access as and when you need it when your caring role changes.
Yeah. That's quite interesting, and we'll get to something later around what solutions the private market can do to support that access to respite. We're going to move on to sort of the government and the government dealings with unpaid carers. I read the white paper, particularly the part on talking about unpaid carers that published in 2021. I don't think there's been any sort of further publishings of it. But what's your thoughts about the white paper and the measures? Have they been rolled out sufficiently according to your understanding? There was a £25 million that was allegedly allocated in October 2023 to improve services. Do unpaid carers feel that effect of that money being allocated for them? What's your thoughts?
So that fund, that 25 million was, I think you're referring to the accelerated reform.
Yes.
which on paper looked brilliant. And we were excited to see that, because our belief is you need to start innovating, to try new ways of working, to see which works. And you're going to fail in a lot of those ways, but you need to keep trying new ways.
Yeah.
And this fund was basically saying, go and try new ways of working, and then we'll see what works, and then we can start to invest in those programs. And we thought, brilliant, here we go. So we proposed a range of kind of solutions that we thought could be implemented. And, speaking quite frankly, it just wasn't implemented. I mean, in our area, Bedford and Central Bedfordshire, I don't think we've seen that money go anywhere because they couldn't agree on what they wanted to do. And it kind of comes back to that bureaucracy. Not just trying and getting on with things, and that bit more of almost an entrepreneurial spirit, really, of trying to go after the challenges. So again, it's a bit like what I was saying with the Care Act. Central government seems to have had the right ideas. It just doesn't seem to get implemented at a local level for different reasons. But I was excited for that fund, but it never really had any material difference.
So do you think that's to do with sort of quangos, to do with government departments not necessarily knowing the procedure or being able to agree on, as you said, on the procedures for that to be rolled out, what the thresholds are for, getting that fund allocated? Because I thought the premise of this money was to, support and enhance their lives directly, but that's not happened.
I don't think you'll find a single carer in our area that would say they've seen any benefit from that. And I certainly haven't seen a penny of that go on to anything in our area. So why that is, I would say it's complicated. They needed the local authorities and health to work together to put together a bid. So then you're bringing together different cultures that work in different ways. So again, bureaucracy, those sorts of things. And I'm sure if you put that money into the private sector and just said, figure that out, it would just get figured out because, you do what you got to do. So there's all sorts of complicated issues there. And I might speak too frankly on that, really, but that's now perceptive.
Please feel free to. Thank you for that. Again, it's something that I think we can, try and piece together a bit later as well. You stated in your recent article, again, I believe it was the Carers Trust, that there are 104,000 carers using food banks. Do you think that this, the government has failed carers? Quite frankly, has the government failed carers if we have that many thousands of carers using food banks, unable to, afford their own food?
Yeah, I mean, I think if you just take a step back and look at the health and social care as a sector, and how many times have we been promised that there's going to be the reform that's needed, and that hasn't come to fruition. So I would say, have carers been forgotten and failed? Absolutely, yes. My instinct is I don't think they feel they can afford to really just to address this issue. There's so many carers out there. I mean, the other statistic that I sort of go back to is the amount of support that unpaid carers provide is the equivalent financially as a whole other NHS. That's the amount of funding they sort of absorb.
It's 162 billion, wasn't it?
Yeah, it's a huge number. It's a huge number. And there's no way you can remunerate carers appropriately for that work. But what carers are saying is, we're here, see us, recognise what we're doing and try and help in a better way than you are. And I think not addressing the health and social care as a whole complex problem is one way of saying to carers, you just keep carrying on, shouldering that burden.
We know government, after government keeps kicking the can down the road in tackling the issue of social care, both with paid carers and unpaid carers. That's a big problem. I mean, I experience it from the private market as well. And the costs are going up. The amount you're paying carers are going up, but yet the charges in which you can charge the local authority, it continues to reduce, and not in line with inflation. So it becomes harder and harder even for private.
Yeah, and we're the same. When national insurance rise, it's just come in. That will hit you, equally as it hits us.
That's a very, very good point. I was going to ask about how it's affected, the charitable sector as well. So does that affect you, this NI increase? Because for myself, this the reduction from 9,001 to 5,000 threshold, as well as the increase from 13.8 to 15%, is going to cost my company. And again, I'll be quite frank with this, because we do need to put pressure on the government. It's going to cost us around about £250,000, £250,000, which you're going to have to absorb from somewhere. It's going to come off our margin, and that's unbelievable. It's a tax on people, on employers who have staff. How does it affect you?
Yeah, I mean, our financials aren't that extreme. I mean, it would be similar in percentage-wise, but we've got to find another 30,000, to cover our shortfall. But we know hospices, for example, that Keach Hospice, I think, is around 350,000 they've got to find. It doesn't. We're all trying to shoulder that exactly the same way. But again, just by the fact of doing that and applying that pressure to providers that are working at the front line on health and social care, it's a people job. You need people to do that job.
Exactly. We can't go away from that.
So the fact that there isn't any recognition or that just, again, sort of shows the sort of respect I think we as a broader sector, both private and charitable, are show.
Yeah. Yeah, thanks, Chris. I mean, you mentioned about this, we spoke about this 162 billion, which is a big saving on government spends that unpaid carers essentially shoulder. What do you think can be done to leverage this contribution to enhance the lives and of carers and increase the opportunities in terms of, is there a way to sort of raise this as a quite a significant figure? You said the same values at NHS, to sort of show the government that actually they can and they should spend more on unpaid carers, because what could happen is if they did start to go down the care route to paid care, then of course it's going to cost the government tons of money. So what can be done to leverage this?
It's a difficult question to answer because the first answer you go to is money, but you can't afford to do that. It will cost you too much.
Yeah.
So it's how do you sustain carers in their role for as long as they're able to?
Yeah.
And carers tell us time and time again, make sure that we are healthy. Every unpaid carer is entitled to an annual health check, but I probably guarantee about 90% of those carers don't take that annual health check or aren't aware of it because they're not made aware of it by their GP. The carers allowance is one way, and that's increase has helped. But before, carers are really penalised for having a part-time job as well as caring. And, this whole unemployment rate and the skills gap and all of that, it's a separate issue, but it's intertwined. You want people back working to contribute to the economy for that to grow.
Yeah.
Then you need to make progressive moves to allow carers to balance those two, because they can do much more so now with the work from home kind of culture that's come out since COVID.
Yeah, the commitment living at home. Yeah, absolutely.
And we've seen rapid advancements in technology and everything like that. And this is why I sort of call for a bit more of a radical shake-up of how we're trying to support people, because the landscape significantly changed over the last few years. Yet, no doubt, legislation and policy and practice on the floor is about 15 years behind, and we won't be there to catch up until then. So, it's just acknowledging what they're doing. But the key thing is respite, that access to respite, a break from their caring role so they can maintain their social networks. I was speaking to a nurse the other day who was saying around that isolation can have as bigger impact on you as smoking sort of 20 cigarettes a day or something like that, social isolation in your later years. And that has the same impact on carers. But to maintain their social networks, they need a break from their caring role.
Yeah.
To maintain their physical and mental health, they need a break from their caring role.
Yeah.
And we're not talking about mega time. It's, an hour or so a week.
Yeah.
It's not significant.
Just something to give them a bit of a respite. Well, yeah.
Yeah. Right. Just acknowledge what they're doing.
And you mentioned about radical shake-up, and I think your article was quite potent. Quite pertinent. The house is on fire. Isn't that what you said?
Mm.
And I think using terminology like that does get people, to wake up and have a look. So I think you used the right rhetoric there. You mentioned also about the £40. This is the £151 to £191. That increase of £40, increase in the threshold for carers allowance. You mentioned it's helpful in which way?
So it increases the amount of time a carer can earn. So it increases the amount a carer can earn, really, before being penalised and then not receiving carers allowance.
Yeah.
So that now allows carers to work a significant number more of hours to the point where they can actually now take on jobs. If a lot of carers we talk to in our employment support service and our benefits service, they're just terrified because of this recent clawback on carers allowance that happened a year or so ago. They're terrified that they're going to work a bit too much, or they've got their calculations wrong, and then suddenly in a few years' time they've got to knock on the door and they've got to pay thousands of pounds back. Yeah. And this kind of, again, it's this sort of bureaucracy and this very specific, you can do this, you can't do that, makes carers terrified. Yeah, terrified. But this has allowed that bit of wiggle room where carers now can take on a job for 5, 10, 15 hours a week and not be fearful that they're going to sacrifice their carers allowance.
Yeah, well, I mean, you've stated it, but with the burden that carers have to shoulder already, I think it was about 350,000 carers had to claw back a total of £251 million across the UK. That is an unbelievable amount of money. And to think that they're already being sort of neglected, to sort of put further pressure on them there, that seemed to me unjust. But I mean, did you feel that was justified, Chris?
Yeah, well, I mean, you understand it if you go from a point of view of someone sitting in an office, in a tax office, thinking I need to get this money back. I understand where they're going from, but if you go from a human perspective and think, well, these people are doing all of this work, then crikey, how is that the right decision to ever do that?
There should always be a human element. I always said to government, it can't be straight textbook. Tell me about the We See You campaign. How successful has this been in raising awareness?
Yeah, so I mean, in Bedfordshire, we are fortunate that we do really well in identifying carers, and we've seen a significant rise. The number of carers registered for support with us has doubled over the last 4 years, which is brilliant from our point of view. Wonderful. It means that we're getting the word out there, and what that means, hopefully, is carers will pick up the phone when they start to struggle. And that's the main point. Then we can get them the support they need when they need it. But those sort of campaigns around We See You, and there's another campaign around on carers' rights, they are critical and important. What we always say, though, is the biggest people we need to affect is those health professionals, the first professional that a carer is going to come into contact with in their caring role. So when you think about someone with dementia, for example, caring for someone with dementia, they'll notice the behaviour in their loved ones changing. And who's the first person they're going to go and speak to? It's probably their GP, to say this has changed. And what we know is that conversation there is the GP's not going, they'll tell them about dementia and the diagnosis pathway, but they're not going, you're probably moving into a caring role now. And I would just advise that there's these support channels around for you if you need it. And that's who we think is actually most crucial to target, is those health professionals who are seeing those carers for the very first time.
What sort of services do you offer in Carers in Bedfordshire? Because of course that's what you'll be promoting. We See You campaign, right? This is what you can. These are some of the services, some of the resources, etc. What sort of services?
So, quite a wide range. So we have our young carer service, which is, we have a team who go into schools and do assemblies, do story time with kids to talk about what caring is, that sort of thing. And they also run social groups, events, courses for young carers to go on and all that sort of thing. And then we have a young adult carer team as well who work with those young adults from 16 to 25 who are going through that transition to university, that kind of thing. Are we going to university into employment? What does that mean for my caring role? Can I do both? That kind of thing. So we have a support team for those. A wide range of events and groups. We run treatments for carers, so you can have your haircut, a massage, foot care, all those sorts of things at a heavily discounted rate. One of our biggest services is our benefits advice service. As I was talking to you just now, it's a complicated world out there, trying to know what you can and can't do. And so that's an incredibly busy service that we run. We also have a carers grant scheme. So on behalf of the NHS, we distribute just over £250,000 to carers to help them maintain their caring role, really. So they might apply for a holiday or whatever it might be, really.
Yeah, that sounds like a great plethora of services. I just wanted to ask, because you mentioned about doing benefits services, essentially, and supporting unpaid carers to source various benefits that's out there. What's the difference then with Citizens Advice Bureau? How are you different? Because they also do the same thing.
I mean, we're not terribly different in terms of the service that's provided. But what we knew is there was waiting lists for that service. Yeah. And so we were talking to carers and they were then going to have to wait several weeks to get that advice. So we just brought it in-house to start offering that to try and ease the burden on Citizens Advice. But it also meant we didn't have to send the carer, give them another phone number, go and ring this person to get the solution you need. Yeah. And when you talk to carers, the key thing they'll say time and time again is, I keep having to tell my story every time I go and speak to someone. I've got to tell them everything, and then they've got to listen, and then et cetera, et cetera, et cetera. Just don't give me another phone number. I want to phone someone and then have it the solution's sorted. I don't have the time to kind of navigate all these different professionals.
Yeah.
So trying to reduce the number of phone numbers essentially we're giving to carers or signposting is part of what we do.
Yeah. I was going to mention, how are you funded then? Because if you are funded by local authority, for example, Citizen Advice will get their funding from local authorities as well. Are you also funded by local authorities or national level as well?
Not at a national level. I mean, that benefits advice service we fund ourselves. So that's not funded through the local authority. So around 60% of our funding comes through the local authority and the NHS, and the rest we raise those funds ourselves in order to kind of, beef up the services.
Yeah, fantastic. Thank you. And young carers, I want to get to the topic of young carers just briefly. You mentioned in your opening that there's carers as young as 4. Explain how and why. And
yeah, I mean, so every person that comes into our service is a young person. Or every adult carer, we ask if there's a young person in there and to know if they've got a caring role. And that can be as small as emotional support. So making sure mummy and daddy's okay, making sure their meds have been taken. And it can go much broader than that, whereas they're actually taking their sibling to school, for example, or they're the ones that are phoning from school to check their mum or dad is okay, that kind of thing. It can be a real broad spectrum of needs there. You could be caring for a parent with a mental health condition, a physical disability, or a sibling that's, autistic or has a learning disability, or even a grandparent with dementia that's living in the same house, Yeah. And the point, I suppose, is that we advocate that it might not be visible that caring role has an impact on that young person. It might be that their mum or dad is the main carer, but there still is an impact on that young person, and it's important for them to be able to work through those feelings and to be able to share that. Because often when we speak to young carers, they say they don't feel they can share that at their home. They don't want to be more of a burden because their mum or dad is already dealing with X, Y, or Z. And sometimes coming to our service is the only chance they get to kind of explore those feelings. And,
that's tough for a young carer, particularly, as young as that, but even the carers in their adolescence, it's tough, surely. Have you seen an increase in mental health with carers? And also, are these young carers registering with carers in Bedfordshire? Have you seen a trend of young carers signing up to the service?
It's been a steady trend that hasn't really spiked. Certainly mental health needs have spiked. We now have a wellbeing practitioner just for young carers who works with them through more significant kind of mental health challenges. Again, that's something we fund ourselves.
Yeah.
But I suppose for young carers, it's hang on, Lee, go back to that question again.
Have you seen a trend up in young carers, but also are they experiencing mental health? So because it's tough for young carers, particularly if they're the one, they're caring for their parents, etc. That could take a mental toll. Is there provision? I guess the question will be: is there sufficient provision? Is there sufficient access to the provision within Bedfordshire?
Yeah, I mean, as I said, we fund that work ourselves, so we would advocate there isn't, but I don't think many places would say everything's funded. So you have to work within the constraints there are. So the biggest thing for us is that there's that awareness in schools as well, and schools can identify that need. Yeah. And for the first time, the Department of Education is now part of it. So the school do a census every year to say what type of kids they've got, and they've added young carers now for the first time. So we're starting to see that data come through, and we can see that some schools have no clue that there's young carers in there. But certainly that well-being and that mental health is on the rise with young carers. We know that. And we also know that young carers' attainment at schools is lower than the general population. It has an impact on their attendance at school. Yeah. And of course, then you go from there, it's going to impact their employment opportunities and everything like that. So it's a significant issue, which is why we always advocate for getting it in early, so you can put in more, less intensive resource so that a young person can go on to a fulfilling life.
Yeah, no, fantastic. One of your services is an online support hub. So what does that look like?
Yeah, so at the moment that's essentially guides and resources, and we've got an AI chatbot on there that you can talk to and get the resources you need. But we've got hundreds of guides on there. It's such a complicated world being a carer of what the right information resources are, be it your home environment. You want to adapt your home environment. How do I go and do that? Your financial health suffering, your physical, mental health, all those sorts of things. So you've got a vast range of resources on there, and we're just in the process of updating that to be a bit more in tune with the AI advancements. So there's going to be an update coming through next year where it's a bit more of a personalised support plan. Yeah, you get through the information that's specific more to you and your needs and what you're caring for. But we have over 3,000 people visit that hub every month for support. So it's a well-used resource. And often people click onto that late at night, when
stuck, they need second opinion, they need guidance. Absolutely. Wow. Yeah. And that's it's definitely serving purpose if it's getting that much traffic. I want to mention about from the private market. There doesn't seem to be much happening with that. There doesn't seem to be much, support for unpaid carers and innovative thinking. One of the things that us at Megacare we're looking at and exploring is something called Urgent Support Link, and what that does is it provides reassurance. That's the main strategic aim. Let's provide reassurance and peace of mind for unpaid carers specifically. And what that looks like is they would sign up, they'll register onto this scheme. They'll get an assessment, the sufficient assessment that they need from a private basis, the home risk assessment, their general understanding of what support will look like for their loved one, and that's it, all free of charge. And from that point, they'll be given an app, which essentially they can book a carer from that app, but also schedule it in for the long term. It could be same day. They can chat directly to our offices through that functionality, and it's all quite user friendly. But it can also pick up the phone as well for those who don't like using technology. What's your view on a service like this? It's all free of charge until they book something, right? And they have to they book a care, they book a visit, and up until that point, it's completely free of charge. And I forgot to mention that it also has within it some of the resources, sort of hopefully through API can direct some of the services and things that are that's utilised in carers in Bedfordshire on the app as well. So how do you think that sort of, where do you think that's placed within the unpaid carers world? Do you think that's something that would be useful?
Well, I mean, what that does is it means that you've got a service that's responsive to that change in need of that carer, which, as I said earlier, can change in an instant or overnight. And so that gives them the ability to do that.
Yeah. And
carers tell us they want to be able to have respite when they need it at a time they choose with someone they trust.
Absolutely.
And that gives them that access to that. So that kind of innovation sounds brilliant. But you also say, I mean, I don't see much of that innovation from that sector, but then there's not that much money for unpaid carers, is there? It doesn't follow them. So it's very difficult to kind of expect that all these innovations can kind of take place.
Yeah, because the thing is as well with that, so because you mentioned this quite well, is that there isn't the funding for that. So for example, yes, okay, it's free in terms of them registering and the assessment's free, so they have no cost there. It's an app, they can get that same day booking if they want to for respite or for if they wanted, if an unpaid carer wanted one of our carers to do some activities with their loved one, they'll all be structured in the assessment. So that pie is all it's all well and good. But then when it comes to actually booking, the funding won't be. Is it your belief the funding won't be there for them to get that respite they need? Because that's where it comes to, isn't it?
It is for those that can't afford that privately. Yeah, absolutely. It comes down to that, and that again comes back to a system that is more focused on the carer, so that there is a funding pot in place should they need it at a time they need, and it's there for them to exercise if they need to. Rather than a system which is based around the local authorities and how they work, which is a bit slower and less responsive. Funding will always be the issue.
Yeah, but it's worth a try. I think the private market looking at innovative ways to make carers' lives easier. We're going to move on to barriers, and I am quite interested in the sort of demographic of people that are seeking support from your services. What sort of carers are you getting signing up to your service? Do you have challenges with certain demographics?
So we're fortunate that we don't. I mean, we do this regular, what we call an underrepresentation report, where we look at who's engaging with our services, registering, and then speaking to us, and then move into what we call an outcome. So we've actually supported them to something. And we see from an ethnicity point of view that is almost bang on with what the census says is in the population. So we're pleased there. But that's not to say there aren't those different barriers within those communities. And we know that, for example, carers where there's a language barrier, that takes us 3 times as long to work with that person to get them to an outcome as it would elsewhere for obvious reasons. The biggest underrepresentation is with men and male carers. So nationally, there you go. It's 40% of carers are men, believe it or not, whereas on most services like ours, you've only got about 26% are male carers. And so that's our biggest challenge, is to get those men to just sign up, just in case they ever need someone like us.
Yeah. Because I found with in terms of care provision in general, and this is from the private market as well, it's very rare that you would get, for example, and again, I'm not sort of pointing on any specific nation, but Chinese people sign up to our service for us to provide care for them or their parents. They tend to sort of all do it as a part of their culture, and then care for their parents or they care for their loved ones themselves. And again, it's also quite rare to see, different other Asian minorities as well. Have you found that to be the case with unpaid carers signing up to your service?
Yeah, I mean, not signing up, but the type of services that those different communities access do differ. I was speaking on a South Asian radio show the other night, really talking about those sorts of barriers and how within kind of particularly those households that are multi-generational, so you have different generations within that household. Yeah, there's much more of an expectation that they will care for their loved ones, and you don't need outside support to do that. And there's also sometimes a bit of a fear from speaking to the local authority and bringing them involved as well. So there are all those sorts of barriers. So they certain communities do access our services in different ways. But I have no idea how they go on. So that's interesting to hear how they then utilise kind of private care, really. That's interesting.
Yeah, that's the thing. They don't necessarily utilise private care. I think it's our main demographics is usually English. Speaking English people and Europeans, so Eastern European, as well as maybe some African cultures as well. And that's mainly it. You don't really get, is it Far East? Some people, they sort of want to care for their loved ones themselves, and that's absolutely fine and right. But where they get their support from, because they have all the same challenges and burdens that anyone else would have. So I was quite interested to know as to whether they're utilising your service, and I guess what sort of services, if they are signing up, what specific services are they taking up more? What's the trend?
So a lot of that is with our support work team. So for example, they will receive a letter in the post that they're not so sure on, so they'll talk to our team, and we have a team that can speak multiple different languages. So that enables that trust to build quite quickly. And so our team will take them through what that letter means, and et cetera, et cetera. And they access our benefits advice support quite a lot. Less so much the peer groups, really, unless we run them within those communities. There's less engagement on those, but much more the one-to-one support, which keeps them in their caring role and caring for their loved one.
Yeah, absolutely. You mentioned about some of your resources, the training element of things. Quite interested to know how that's because you've got the online resources, right? So they can get on the online support hub. But in terms of practical training, like I know from a private market, I mean, people, our carers are trained on moving and handling, for example, and basic life support. Do you have that provision within Carers of Bedfordshire?
No, so that's something we've been arguing for quite a bit. I mean, what we have is what's called a Caring with Confidence program. So that's like a 6-week course. You can do it in person with other carers or online, which goes through all of the practical things you need to know legally, how to look after yourself, those sorts of things. We have run emergency first aid courses and moving and handling courses. The problem is carers don't see that as a need. They don't necessarily see that terminology and think, oh, that's what I need to do. They're just picking up their loved one and not thinking, oh, crikey, I'm doing this the wrong way.
Yeah.
And we do provide those interventions, but and that training, but not to nearly enough people. They're not accessing that nearly enough.
I mean, it's so fiercely regulated the way that we do handling in the private market, to think that just sort of risking their musculoskeletal, for them, risking their backs and everything else, and all the injury from just doing it without. It begs the question as to why there isn't sufficient. There's not sufficient cultivation of resource for that to be done for unpaid carers specifically. Again, it goes back to unpaid carers necessarily not being taken seriously or recognised for what they're doing, and the fact they need to be safe doing what they're doing. But no, thank you for that, Chris. So technology. What sort of technology have you explored? How does technology play? What role does it play in the work you do?
So we use technology all the time in how we run our service. But in terms of for carers, technology doesn't play nearly enough a role as it could do for carers. Now we've seen, we've looked at, we've promoted kind of those in-home monitoring devices that can help you support your loved one from a distance. So if your mum or dad lives a few miles away, but you want to know they're moving around,
these sensors,
those sorts of things, but that sort of just check in and let you know, well, at least my mum or dad's moving around, so that's fine. But those aren't utilised nearly enough. And there's all sorts of other bits of technology that's available right now, but carers just don't know about it. They don't get to feel it, handle it. They don't have someone to come and fit it for them. There isn't a help, that sort of thing just isn't there. We're still on that key fob, the fall alarm, which is great, but technologies move rapidly, and we have not caught up to support carers. And now we're on to like the next stage of digital revolution with AI. And again, there's huge opportunities there for carers, huge opportunities. But there isn't enough money in that sector to bring in that innovation that's needed, and that's part of the barrier. And what I hope that Accelerate and Reform Fund might have been able to help us move towards is to use it for those kind of things.
Absolutely.
Get there.
Yeah, absolutely. That would have been a perfect, thing to use it for, technology innovations. It can be quite expensive, all this technology. And you mentioned about the in-home sensors that can be, in the thousands without it being subsidized. It'll be difficult for unpaid carers to, jump on that and start utilizing it. We've explored a few, in the private market, a few different technology innovations. I mean, such as, vital signs monitoring, for example. It's just very, very interesting bit of coding, right? We've invested in that. You have to build the front end app, and we've done that internally as well. You can sort of take a picture, like a scan of someone's face, of a service user's face, and it will give you their vital signs readings, such as their blood pressure, their heart rate, their oxygen saturation, etc. It's quite quite handy to understand, where they're up to, and be able to give advice as well, and of course advise the GPs, etc. Would something like that work within, in a day-to-day life of unpaid carers? Although it is quite pricey.
Of course it would work. Yeah, I mean, it would work, but you'd need a team on hand to kind of help carers navigate just the practicalities of using that technology. But that's
clinical background as well to understand what you're reading.
Yeah, to a certain extent, but if you're diabetic now, you've got that app on your phone, and you expected to read those results yourselves. So again, the technology's there and could be far better utilised. And you talked about the money there, but then when I speak to the health service and they talk about the money on what they call a hospital avoidance, so if you can avoid someone going to hospital, it's a X amount of thousands of pounds. It's just connecting those dots, isn't it? Back to, well, if we put this intervention here, yes, there's a cost here, but let's track that. And does that actually save us money here? And, move into that preventative model, but actually track it to make sure we then are stopping resource, putting resource in at the end, so we are saving money. That's what it's about.
Yeah, no, you're absolutely spot on, I think, there, in terms of putting that in place with the unpaid carers. There's many more unpaid carers than there is service users being cared for by the private market. That would be huge in terms of prevention. And actually, what you can do with technology like vital signs monitoring is make it very understandable in terms of what it's saying. What if your heart rate is up, what does that mean? So that can be a good indicator as to whether you need to contact your GP or phone 111 or, drink more water, etc. So there is things that can be done, and that preventative piece that can really help the health system as a whole. But we're not doing it. And again, it goes back to that money, that accelerated fund that could be utilised for that. That could save the system a ton of money.
And I've long advocated for just trialing in new ways. Pick a geography that's a small area and just put those interventions in, learn your lessons and see what you save and what you spend, and then go from there. But we can't just sit here hoping that it's going to solve itself, because it isn't.
No, absolutely. One of my final questions, Chris, as leaders in the social care or care industry, what can we do collaboratively and individually to sort of generate that understanding and recognition that unpaid carers need for the industry, to sort of put this on the forefront of government agenda?
Well, I always say, there's thousands of carers out there, and if they all drop their role tomorrow, then the country just stops working, because it would just be too much of a burden for the country to do. And it's about trying to mobilise those carers to know they have a voice, and to use that voice to speak to elected representatives to try and generate that groundswell of movement, I suppose. And that's the biggest thing. So as leaders, it's about trying to give those opportunities and avenues for carers to share that voice, and to just try and the biggest thing is to try and remember that we've got to keep that humanity within it, because when you're leading one of these services, you're under so much pressure to just deliver within the financial envelope. You can almost start to become a box ticker yourself, and you're looking at the numbers, and it's to remember we've got people that we're trying to support at the bottom of this, and that's the most important thing. So it's just always going back to that root cause.
Yeah, there's a person always behind every decision. All right. Thank you, Chris. A couple of quick fires.
Oh, okay.
A couple of quick fires. What's the best piece of advice you've ever received?
Crikey. I would suppose if you want to go fast, go alone. If you want to go longer, go with more people. That kind of advice. I can't remember the exact quote, but it was something like that. Take people with you. Yeah.
Yeah. Wonderful. And if you could have dinner with any historical figure, who would it be?
Oh, that's a very. I would probably be going back to Winston Churchill, and just to know how he was coping in those dark nights and things of trying to keep his resolve when all around him were saying, to throw the baton in. So I think that's
that's a very pertinent one there. I'll just say Thatcher, big Thatcherite. What's your go-to guilty pleasure after a long day?
Oh, it's always going to be pizza and a beer for me. It's as simple as that. Simple, man.
Oh, wonderful. Thanks, Chris, and thank you for your time today.
Thanks, King.
Yeah, much appreciated. That's the end of the first edition. Much appreciated. Thank you.